Hi, everybody. This is Chris George, medical oncologist at Delnor Hospital, and I'm joined today. We're really happy to be joined by Dr. Elizabeth Lowden at the Delnor Metabolic Center, and Dr. Lowden is the medical director of medical weight loss management at Delnor Hospital, and she's been here for how many years?
Almost 5.
5 years, and done a lot of good work, a lot of great things, and we want to hear more about how metabolic health and weight loss can affect cancer patients and cancer survivors today. So thanks for joining us. We're going to be wearing masks today. I think the camera might make it look different, but I believe we're 6 feet apart. But just in case we're not, we're going to keep our masks on. So Dr. Lowden, I thought maybe we could start, if you could just tell us about your background and how you came to be the director of weight loss here at Delnor.
Sure. So I've always been interested in health, nutrition, wellness, weight management. So I studied nutrition as an undergrad before I went to medical school, and then tried to figure out the path that would get me here. Because when I was training, this was very non-traditional. It is still somewhat non-traditional. And so looking at all my options, where I felt I could make the biggest impact was with adults. So I went into internal medicine and decided that studying hormones with endocrinology would be the most helpful. So I went on to an endocrinology fellowship and tried to choose a place that would give me a broad background with obesity management too. Because endocrinologists deal with such a wide range of hormones, but obesity and weight management are very tightly linked with hormones. And so I wanted to have a nice background for that too. So I essentially made my own path here and then joined Dr. Pittman, who's our surgical medical director here, to found the medical weight management program.
So I think most people, when they hear endocrinology, think of thyroid disease and diabetes, obviously. How many endocrinologists do what you do and focus on metabolic health and weight loss and weight management?
Not many.
Okay.
Not many. There's usually one in every major medical center, at least in the Chicagoland area that I know. It's a very small group.
Yeah.
They're starting to make more obesity medicine fellowships, but this is a very new it's uncharted territory, really, and it's just it's emerging as a specialty. So I expect that there will be more, but for now, very few.
How many hospitals in the area have a program like you've built here at Delnor?
I know many of the major medical systems downtown.
Loyola, Rush.
Rush, University of Chicago, Northwestern downtown has a fantastic group that we're affiliated with. I know some of the smaller medical groups also have smaller weight management programs, not necessarily metabolic centers the way that we've done.
That's amazing. So it's we're always thrilled. Delnor is kind of a smaller hospital, but to have a program like this, that's not something you typically see at a 130, 140 bed hospital.
It is not. And so within the Northwestern system, we have essentially hubs for the regions. There's one in the central region downtown.
Okay.
We are the hub for the western region in the suburbs. And then there's also a group in the north region and the northwest region.
Okay, wow. So we talked a little bit about what you do and a couple terms that have come out: obesity, obviously, metabolic health. Can you explain to someone who maybe doesn't quite understand that? Is obesity and metabolic health, are those the same thing? Or are they linked? Or how do you think about those two?
They are linked, but they are different.
Okay.
And so obesity is truly defined just by weight parameters. And so we're essentially looking at someone's height, someone's weight, the ratio between them, and giving them an arbitrary cutoff of what their body mass index is or their BMI.
Okay.
And those cutoffs put you into a category. And those categories, normal weight, overweight, obese, morbidly obese, come with different risk factors. But people can have extra weight and not necessarily have those risk factors that have manifested as a problem yet.
Okay.
Metabolic health is very different because you don't need a weight issue to struggle with metabolic health. So, metabolic syndrome, it's a constellation of symptoms, increased waist circumference, which we could presume that you have increased fat mass wrapped around the organs, high levels of triglycerides or low levels of the good cholesterol, HDL, high blood sugar levels, and high blood pressure are all associated with something called metabolic syndrome, which is it's not a disease process in itself, but it puts you at risk of developing these other metabolic diseases like diabetes, heart disease, stroke, all of these things that are associated with obesity, but you can have them without struggling with extra weight.
I see.
And so what we try to do is separate the two, say we do want people to lose weight. We want them to reach these kind of arbitrary BMI goals because we know their risks of diseases are lower. But what we really care about is what's going on underneath.
Okay.
How are things biochemically changing because of the extra weight or lack thereof? And how can we improve someone's health by focusing on that?
So you've touched on some things that I think are super important, right? High cholesterol, high blood pressure, hypertension, things that kind of define that metabolic syndrome. So I think I know the answer to this, but can you talk about the impact that those factors have on, I guess, health in America?
Woof.
Is it small?
It's quite large.
Quite large.
So, every year there's data that comes out about how many people in the United States just even struggle with these issues. 5 years ago, that number was 70%. That was 5 years ago. And it had increased somewhat exponentially from the 80s and 90s, so I can only imagine what it is now. But it's ubiquitous. Everybody seems to have some sort of connection or difficulty with something metabolic, or at least know someone who does. So it impacts everybody. And
you talked about developing heart disease, stroke, diabetes, and so forth. How about something that would touch my specialty, which is cancer? When we talk about risk factors for cancer, everyone thinks of smoking. How about the metabolic syndrome and obesity?
So there are links. Most of the studies don't show these direct causations. Having extra weight doesn't cause you to have cancer. But having extra weight or metabolic syndrome increases inflammation. It increases insulin, which is an inflammatory hormone, which can lead to changes in other hormones. It essentially sets up your body in such a way that cancers might thrive. And so there are some cancers more associated with weight. Some of the more hormonally induced cancers, breast cancer, uterine cancer, ovarian cancer. But there's some that are pancreatic cancer, colon cancer, thyroid cancer, so it hits a lot of systems the way that just normal excess weight does.
So we see it a lot, patients developing these cancers. And what I typically tell patients, if you live healthy, you decrease the risk of getting cancer. And if you still get cancer, which happens even in people who make all the right choices, you're way more likely to do well with treatment and survive it, for sure. Do you at the Metabolic Center at Delnor see cancer patients or cancer survivors? Is that part of what you see over here?
It is. So we don't see as many active cancer treatment patients, primarily because the goals of your treatment and my treatment are very different. We'll sometimes see patients that need to lose weight to have a very specific surgery. They need to go on a rapid weight loss diet to make that surgery safe and will help accomplish those goals. Or we help reduce people's risk of recurrence. So usually after their cancer treatment is done, they've been cleared, it's safe for them to do something more aggressive. Then we pay more attention to, again, those metabolic components, try to reduce the weight to reduce that risk of recurrence.
And can you go into a little bit of detail about the strategies that you use over here to help people get to their ideal body weight or drop some pounds?
And I like that you said ideal body weight because not everybody's body weight everyone's body weight is specific to them. So even though we might say, you should get to a BMI of 25, if someone has 150 extra pounds of fat mass, that's going to be really hard. And we don't want people to feel that they failed because even small reductions in body weight, 5 to 10%. So we're talking 10 to 20 pounds for someone who's 200 pounds leads to dramatic improvements in metabolic health.
So you define success differently depending on the patient.
Right. So we try not to use these arbitrary cutoffs. We try to take a very individualized approach. But people need different things too. There's a myriad issues that cause weight. There's metabolic, there's hormonal, there's social, there's physical, there's mental. And so you can't address it without thinking about all of those things. And so all comers can't be treated the same. So we usually spend a lot of time talking with each person, say, what are their struggles? Do they have any sort of medical issues, or are they on medications that impact their weight? Are they on aromatase inhibitors after breast cancer? And that has impacted everything and made a struggle, right? Is it that their mobility has changed, or they were put on psychiatric medications or insulin? So we focus on the medical component. Work very closely with people's primary care doctors and specialists because we don't want to impact their other treatments for our,
Sure.
because we're trying to hit our goals. We spend a lot of time talking about the psychological aspect, what food means to people. Do they have disordered eating habits? We spend a lot of time educating about what kind of normal, healthful food is. Most people who struggle with weight know what healthy food is. It's not a nutritional
Right.
education deficit, it's something else. So we're trying to help them figure out that's something else. So we have them work with our dietitians who are all trained with weight management.
And they're here? They're part of the program here?
Part of the program. So when people come in for their initial evaluation with either me or our nurse practitioner, they'll always see a dietitian afterwards.
Okay.
And then patients opt to continue with it depending on what they need. Sometimes they just opt to meet with a provider then. But we utilize dietary changes, lifestyle changes. We have a health psychologist on site.
Oh, you do?
We do. She does more with our surgical patients.
Okay.
But she also has a ton of resources for people. We're paired with the fitness center with some really nice programs to help.
Fitness center at Delnor.
Correct.
Okay.
To help with physical activity, especially people that have medical issues or limitations. And we use all of the approved weight loss techniques and therapies. So medications, we have a meal replacement program, we have bariatric surgery.
And among patients who come over here motivated, eager to do what is required, how often do they lose weight or improve their metabolic health, might be a better way to say it?
So very often.
Okay.
It's hard to quantify because there's so many differences. But most people that come with the motivation, the tools, the follow-up, who really make use of the resources, they do well. 5 to 10% is average weight loss worldwide for lifestyle changes. But I've seen more than that.
Wow.
I've seen people lose up to 20, 30% of their body weight with lifestyle, which is not common. But those people exist, and I believe we have the resources to help them get there.
And can you talk a little bit about, I think lifestyle changes, learning how to eat, dietary changes and so forth, exercise. Those are things that are, I don't want to say everyone knows all about it, but they're
right.
Common
These are
sense.
common.
Can you talk about maybe things that, we got a fire alarm. Maybe things that people at home might know a little bit less about, like, I don't know if there's medications that would ever be appropriate, or surgery even.
So the lifestyle changes are key. You can't lose weight if you don't make changes to your lifestyle. But sometimes people need to get over that stumbling block. There's other things that get in the way, either hunger, lack of fullness, cravings, binge eating, or sometimes even just insulin, lots of medical issues that you can take it to a point, but you can't take it all the way. Or people have these hormonal adaptations to large weight loss. So if you lose...
That? Hormonal adaptation, what does that mean?
So essentially, as you lose weight, your body tries to counteract that. And so you can have increases in the hunger hormones, decreases in the fullness hormones, and those don't necessarily go back to normal even after you have been at that weight for a while.
So your body's still...
Your body's fighting you.
Fighting?
Right. So I describe it like it's a programmable thermostat. You're in your house, you set your program, and you expect that program's going to run, but one day it's really hot, and so you turn it down. But if you don't pay attention to that thermostat, the program's going to kick back in. It's not going to stay at 68 forever. It's going to pop back up to 70. So normal dieting is like looking every 2 hours and turning the thermostat back down.
Interesting.
Very few things set that hold button. Surgery is one of them.
Okay.
So for some people that have a lot of weight to lose, it's not that they don't have the motivation or the will or the tools, but at some point your body fights.
Okay.
And so we use all of these other therapies to help you get over that hump.
So does everyone who comes here get to talk to us about surgery, introduced to surgery? Is that something that everybody gets, or is that tailored to a certain group or population?
So we offer it to the people that it would be appropriate for.
Okay.
So let's say someone comes in and they've never thought about surgery before. They just know they need to lose some weight or become healthier.
Okay.
When they meet with, everyone starts with the medical side. So me or our nurse practitioner, we run them through all the possible options. So, if they would qualify for it based on the FDA indications for it, then we say, these are your options. We could work on the lifestyle and you could do great with that. Or if we need more help, maybe we bump up and add medicines or the meal replacement, or, you might not have thought about it, but you could be a candidate for surgery too.
Okay.
Some people are very excited about that. Some people aren't.
Okay.
And we never push things on anyone.
Right.
Because this is a very kind of personal decision. But I want people to know, if they didn't know, what their options are.
I have had patients where I've suggested maybe coming over here for a consultation, and that they mentally think, well, I don't need need gastric bypass surgery, so that's not for me. The Metabolic Center wouldn't have anything else to offer, but it sounds like you definitely would.
I would say, at least since the medical side came on 5 years ago, our non-surgical growth has been, again, exponential. I'd say most of the patients that we see aren't interested in surgery.
So I can imagine people at home watching or listening to what you're saying and wondering if this might be a place for them, if you might have something to offer them. Could you maybe talk about who are the ideal patients who could benefit from a visit to the Metabolic Center? So
really almost anybody. We see more patients that need to lose weight.
Okay.
And so typically patients, anyone can come in and speak with a dietitian. Regardless of where the weight is, if they need to gain weight, if they need to lose weight, if they just want to improve their aerobic capacity in their exercise, you can talk with a dietitian. If someone wants to meet with me or with our nurse practitioner, we almost always try to keep their BMI above 27. And that's because we can only use the other therapies when their BMI is above that point. So you need to have some weight to lose. However, if someone was interested in metabolic health, maybe they've gained 20 pounds, but they're still in a normal weight. But gosh, they're really concerned. They have a family history of diabetes. They feel like they're getting darkening around their neck or other signs of insulin resistance. They can absolutely come in and get evaluated.
Are most patients referred by another doctor, or do they self-refer?
It's a big mix.
And come in a big mix.
So you can self-refer.
Okay.
But you can also ask your doctor to put in a referral for you. There's some things we don't see, though. We don't see children.
Okay.
So anyone less than 18. Lurie Children's Hospital does have a program at Central DuPage.
Okay.
That does take children.
Okay.
And we don't see people who have active eating disorders. So someone like has anorexia, bulimia. We do see binge eating. Okay. But if someone needs an escalation care, we'll refer out for that.
Is that an eating disorder? Is that, would a patient know if they had an eating disorder, or might they even wonder if they have one?
They might not know.
Okay.
Some things will be more obvious.
Okay.
Anorexia, very low body weight, very rapid weight loss.
Okay.
Not eating. But sometimes people have bulimia or derivations of that where maybe they're not throwing up. Maybe they're using exercise or strict dieting to compensate for overeating.
Okay.
So,
and what you're saying is if you get a sense that someone maybe has a deeper eating problem, that would be something that you would steer them in a different direction than the Metabolic Center. So
I don't think people have to worry that, do they have disordered eating? Are we just going to put them on a pill that's going to worsen it? Absolutely not.
Okay. I hate to ask this, but I'm sure people at home are asking themselves about insurance coverage.
Oh, yes.
What's covered, what's not? Is this something that's part of routine care and so forth?
So insurance coverage is variable.
Okay.
Medicare had decided years ago that it would include things like nutritional counseling as part of their coverage. They had very good coverage for it. But all insurance companies didn't follow up with that.
Okay.
However, we are not a weight loss clinic. Our goal is on metabolic health. So we focus on we call them comorbidities that deal with people's weight.
Okay.
So if someone comes to see me, I'm not just talking about their weight. I'm talking about how their blood pressure is impacted, how their thyroid, their stroke, their heart disease. And so many insurance companies will cover those discussions.
That makes sense. So we would not describe this as a weight loss clinic. This is, you're looking at arthritis.
Correct. Metabolic health.
Okay.
And so, of course, there are every once in a while some people that still don't have coverage for it.
Okay.
But the vast majority do.
So I have a lot of questions about cancer. I mean, I'm a cancer doctor, and I get questions about diet and cancer all day long. And my experience is if you do a Google search with veganism cancer, vegetarianism cancer, ketogenesis cancer, sugar cancer, they're going to tell you every diet is bad and every diet is good, and it's just hard to get good information. Do you have, I don't know if you have a specific recommendation about a specific diet. But maybe just any comments that might help patients kind of steer through all that information on the internet?
That is not unique to cancer.
Okay.
Anyone going online is very quickly going to go through the rabbit's hole of, this is the only diet that will ever work because it worked for me.
Yeah.
And all of the information is contradictory.
Yep.
So you have to imagine that it's an issue in normal life. But when someone has cancer, it's a scary thing. There's a lot of unknowns. They don't have control. And so sometimes what they do have control over is their lifestyle. And so it's easy for someone to attach onto something and say, this is going to be it. This is going to make my cancer go away or make me not have a recurrence.
Great point.
And it's not necessarily the case. So you will find data to support any diet type, just like you will for normal weight loss.
Yep.
And there can be good studies that support those. It doesn't mean it's right for everybody.
Are there any bullet points that we could make to people out there dealing with cancer treatment or who've survived cancer about maybe, I don't want to say that you need to eat the Dr. Oz, 10 cancer-fighting superfoods every day, but are there a few things that maybe they should keep in mind as they choose what they eat every day?
We are very supportive of moderation in general.
Okay.
So I'll give some examples.
Okay.
I'm a visual person. Right? Like, who knows where you're going to end up. Every time you make a decision about a food, you're changing your course. So every time you're given that option of, do I want French fries or do I want broccoli? We know the broccoli is a better choice.
Right.
So it's these little things that add up to really big changes, following a very balanced, lean proteins, heavy in vegetables, fruits,
Okay.
complex carbohydrates is always going to be the better option than a diet primarily that's fast food.
Okay.
But another example, if you put 3 people on a basketball court, me, LeBron James, and Michael Jordan, and say, who's the best basketball player? Okay, they know it's not me. But you can argue about the others.
Yeah.
Same thing with food.
Yeah.
What's a better vegetable? They're both vegetables. We know that that's better than fast food.
Yeah.
So you have to think about things on a spectrum. Everyone knows what healthy eating is. Almost everybody. And if they don't, we will teach them.
Yeah.
But focusing on what you know is going to bring your body nutrition, health, that's really what you want to be spending your time and energy doing.
Yeah.
The very dramatic diet types are very hard to sustain. So unless your doctor recommends a very specific diet for you because of your specific cancer, you are not going to go wrong by just choosing healthy options.
That's good. That's really good advice. I am wrapping up. Maybe there's some questions from viewers that people want to get into.
A few questions. What do you do for people whose BMI is too high for bariatric surgery?
So every once in a while, we will come across someone whose BMI is too high for bariatric surgery. That number needs to be quite high. And so, for example, our surgeons very rarely do surgery on someone who has a BMI above 70. We'll often ask them to lose weight to a BMI of 65, but most people fall well below those categories. So if they need to lose some weight, I can think of a number of patients we're working with right now that our goal is to get them to that surgery. And so we use medications, dietary techniques to get them there. And our success rate so far has been almost 100%.
Wow.
Another question is, a viewer states they're receiving chemo monthly. Does that mean they would not be a good fit for your services?
I would say at this point, yes. If you're actively undergoing chemotherapy, now is not the time to be making aggressive lifestyle changes that could lead to weight loss. Because, one, you don't want to counteract anything that's going on from the treatment team. You have a team of dietitians that will work with people to understand what their needs are. But cancer and treatment can be very catabolic. It can break things down.
Yeah.
You really want to focus on health, feeling good, getting through your treatments, and we'll figure everything else out later.
And you bring up the dietitians, and so could you talk a little bit about how the dietitians here that work with you might differ from the dietitians patients see at a cancer center?
So dietitians, fantastic. Part of the very big, association with very kind of firm dietary recommendations. So they know the nutrition, but sometimes you focus on slightly different things depending on what your goals are. A weight loss goal and diet plan is very different from a plan for weight gain or muscle retention or muscle changes or seizure prevention. And so the dietitians here have special knowledge of metabolic diseases, diabetes, and weight management, as well as pre and post-surgical vitamin monitoring.
I think last question that came in, a viewer is asking the meal replacements, bariatric surgery are expensive options. Outside of those, are there any other suggestions to help with weight loss?
Yes. So bariatric surgery and the meal replacements are just really a small part of at least what we do here. I know they can be much bigger parts of other weight loss centers, but we spend a lot of time focusing on education. So people meet with our dietitians to have kind of one-on-one discussions. They can meet with, me or our nurse practitioner to use things like medications, which sometimes are covered by insurance, sometimes they're not, but we do have a number of affordable generic options too. So we really try to work with the person because weight and excess fat don't discriminate. Some people have more access based on their insurance than others, and we all deserve the same health.
Well, that's all that was really great, Dr.
Okay,
Lana. I learned a lot, actually. Definitely appreciate your time. And thanks. We can do this again sometime. That's
Sounds
great.
good.